we have two options now. We now have the MyEye2, which is the disposable needle arthroscopy unit, and we also have the ultrasound transducer. Now this device comes with two ultrasound transducers. It comes with a linear transducer and also a curved transducer, so we can use this for the breadth of musculoskeletal sonography that we need. And you can see once we go to the ultrasound feature, it gives us a very easy to identify anatomical grid, and we can just pick the anatomy that we're trying to scan. So there's some presets already built in. We can hit shoulder, for example, and now we have shoulder presets. So this is the linear transducer. It's got a button on it that allows us to start and stop imaging. Here's some very simple controls in terms of gain. This is depth. This is frequency, so we can go from 10 megahertz to 15 megahertz. And this bottom button gives us the ability to record loops and record still images. So that's the ultrasound component. Up in the top right corner, we can see a new feature. If you've been using the MyEye before, we now have a toggle button that allows us to switch very rapidly back and forth between ultrasound, which is primarily an extra-articular tool, and the MyEye, which is an arthroscope and is an intra-articular imaging tool. So now we could use the ultrasound, for example, to guide an injection. I've used this to guide a MyEye into the hip. It makes it very quick and easy to make sure that we're entering the hip safely from a lateral approach. We can use this any place we want to guide an injection. So again, this toggle button is a relatively new feature with the MyUltra. It wasn't on the MyEye because we didn't have ultrasound on the MyEye.